Abusuafo me mobibia draw eba Oheneba Media so Facebook Live and YouTube account no so ye Oheneba Media. Mo amabaso nyina mo de ane se mo be share video na maye na yetimi abonkomo. Ye nyina ye nim se for some days now most of us any betiefu nyina dodo no ano ya house arrest and say yare bia atene ho agu montene so a sabi yenya ne no egu bre sese yade no spread ya na spread ya but and say report why en say kika no e bread say ye education kakra bi e wo ho na yetieti kwan ye befa so a ibisi anu san say initially na ye free say yare no ya yare bi a entimi enye entaban wiase na ebikura so free say aya agudisem it's not do no pay attention ye but now it look like say ya no say ya ntu anu ana ya mpe na nenu egubra aduru ne kese bebre ewiase fitia no pa me ankasa me nche dem pa ni nyina ne say upie kura anu akohene and churches anya so churches bebre omo mbie anya sorry okoso bebre ayemie etina nso ye Monday most of the children's anan kra no holidays esi omo nkosku na yade na nkasa say nesitie we are going to talk about it yani Dr. Acheampong the United States of America or America one of the centers nimi yare nde say nesitie ehon sensem ekwan nam so yare na eba sentence edia na ye wa be nsa yade ni we de ye kasa local language na doc oni ye ba be bon komo na ye di ni nyina ho komo ne hu kwan ye be fa so a yare no ye betimi abo ye ho ban na ye tu ho anamonti wo ba wo de ane se wo be share video na maye no join me ha ye Oheneba Media e wo Facebook Live YouTube no nso ye Oheneba Media ko Oheneba Media na ko subscribe my na enkomo bi ye be bia no you will be the first ubinya notification na fi wetime ne yedi enkomo bibre na Ebra me beka say na Ministry of Information so omoni Ministry of Health Ghana omo the report to abeg say Ghana so yare no esi ho na ese Ghana yemfa yare ni say e serious because there is this report where ba say you black cry yare ni bi ntimi cho Dr. Metro more highlights on how to say yare no e betimi achi enipatuntum e bi say your blood system no resist yare no e no kre ni nyina ye niam ye ba be di hu komo wo Oheneba Media so nti she video remind me komo ansa na doc ba by ansa na doc bebe no yenko koyo opon komo on Minister of Health let's say Information and Health Ministry omo aye short press conference bi omo brief here am the current situation e Ghana said they are entity but the report why inside country so far nipa ensia enra me kan say nipa miru na nya bi en nipa ensia na enya na omo suspect omo so omo nso ye nya bi no abusiafo ya hwe ya be hu abrotia de omu kwan ho befa so na etu ya Ghana ye be ye den uko enkurase mbebira peme report obi okra wonte yare no ho asem onim hawa ACS spread ndi abusiafo quickly yenko kodwo opon kroma homra oni Ministry of Health press conference no ye na ye wie ya pe na ye ne Dr. Afiah Acheampong abonkomo from United States of America no ne yaka ye krom kasa Ghana kasa no acheche yare nim symptoms kwan ye fa so ba baby akwakodru ne se de be ye bebo ye ho ban ani baby omo wo no say na situation sitie yenko Ghana mra sisia na ye ba ye ntoa enkomo ne so.
Here at the Ministry of Information for this week's Sunday brief. Today we have a brief on one subject and one subject only, on COVID-19. First to introduce to you a number of officials who are with us to support us with today's brief, and then I would invite them to do various parts of the brief. The Honorable Henry Quartey, Deputy Minister of State in charge of National Security, is with us. Dr. Mrs. Martha Jansalutrot is the Acting Chief Director at the Ministry of Health. Dr. Da Costa Boaje is Director of Health Promotion at the Ghana Health Service. Dr. Anthony Insiasari is a Presidential Advisor on Health at the Office of the President. Dr. Bedu Akode, who is here with me and will be doing the first part of the brief, is a Director of Public Health at the Ghana Health Service. Dr. Sally Ann Hine is with the World Health Organization. Dr. Nima Kimambo is the WHO representative in Ghana. Dr. Siedu Bequin is head of DSD at the Ghana Health Service. Dr. Patrick Abuaji is the Director General of the Ghana Health Service. The Honorable Ban is the Deputy Minister responsible for health. I would acknowledge some other persons from surveillance and other issues as we go along. The Honorable Deputy Minister for Information, Honorable Pius Sam Hajide, is also here with us this afternoon. This afternoon's brief is in 4 parts. First, Dr. Bedu Sarkodie will give us a brief on the index cases that were announced on Thursday night and the contact tracing that were announced to be commencing at that time. He would also give us an update on whether or not there are any new cases here in Ghana. Then Dr. Patrick Abuaji will join us with some announcements to reach what they call the triage protocols in all the hospitals and clinics across the country. It's very important, particularly for health care workers across the country. He will reiterate those protocols. The government of Ghana will this afternoon issue a travel advisory, a very important travel advisory, a public gathering advisory, an update on public education, and a media advisory, which I will do later. And then the Honorable Deputy Minister for Health will wrap it up for us with some comments from the ministry that is leading this agenda. That is the ministry responsible for health. So please join me to welcome Dr. Bedu Sarkodie.
Thanks much, Honorable Minister. Your Honor, Ministers of State, heads of agencies, our partners, I can see WHO here, friends from the media, Ghanaians. I provide this date as a follow-up of the press brief by the Minister of Health and Information that announced the first 2 confirmed COVID-19 cases and consequently declared the outbreak in Ghana on the 12th of March this year, 3 days ago. Both individual index cases returned to Ghana outside the country, one from Turkey and the other from Norway. Hence, the 2 cases were both imported. The first case is a man, resident in Accra, who returned to Ghana from a trip in Turkey on the 29th of February this year. He developed symptoms on the 10th of March and reported to a health facility on the same day. He was identified as a suspected case of COVID-19. Sample was taken same day. The sample was sent to Noguchi Memorial Institute Medical Research, and within a short while, we had the report from Noguchi confirming that Ghana has confirmed the first case of COVID-19 in the country. The second case is a 60-year-old man, a Norwegian, who returned to Ghana, Accra, on the 7th of March. He started developing symptoms on the 12th of March and reported to a doctor on the same day. Sample was taken, sent to a laboratory, specifically Noguchi Memorial Institute Medical Research, and we received report later in the day indicating this is also another confirmed case of COVID-19. The 2 reports came the same time because the samples were sent and they were worked on the same time. So we had simultaneously 2 confirmed in this case on the 12th of March this year. For both patients, cases had no symptoms on arrival at the time of crossing our borders. And later, they presented with acute respiratory illnesses. We had evidence of exposure. They had been to areas where cases had been confirmed. Both cases are currently being treated under isolation conditions, and the two are stable. Contact tracing has started. I'll give details later, and it's ongoing. On Friday, the 13th of March this year, 2 days ago, not too far, 2 more cases were confirmed as COVID-19. They reported in 2 regions, one each from Ashanti region and the other Greater Accra region here. The first is a 56-year-old man, a Ghanaian, who returned from a trip in the United Kingdom on the 4th of March. He stayed in UK for 10 days and came back. He developed symptoms on the 12th of March, reported to a hospital in Obuasi, and the case definition met the case that of suspected COVID. Samples were taken. The sample from this case was sent to Kumasi Collaborative Center for cases for research. And within a short time, the lab reported back to us that they have finished the assessment of the report, and this is another confirmed case of COVID in the country. The second is a woman, a female, and a student, Ghanaian student. She traveled out to the United States of America, stayed for 10 days or so. She came back on the 9th of March, and then on the 13th of March, she started having symptoms that later were evaluated to be compatible with a suspected case of COVID. Samples were taken, sent to Noguchi Memorial Institute of Medical Research. Samples were taken on the 13th. The same day, we had a report from Noguchi that confirmed this as another confirmed case of COVID-19. Both are currently receiving treatment under isolation conditions, and both are stable. I'm talking about the 2 of them that were seen the 13th. Yesterday, late in the afternoon, we received a report of 2 new confirmed cases from Noguchi Memorial Institute of Medical Research. The first is the 42-year-old Ghanaian male who returned to Ghana on the 8th of March. He had traveled to Switzerland and UK in the past 14 days. Symptoms started on the 9th March, and he reported to the health facility on the 14th March. Samples were taken, sent to the lab again, Noguchi Memorial Institute of Medical Research. Within a short while, we had the report, and this was confirmed positive. The second case was a 41-year-old Ghanaian male. He reported to Tema General Hospital on the 14th of March with a history of fever and acute respiratory illness. This symptom started on the 10th of March. This case had traveled to Germany and Turkey within the last 40 days. Samples were taken, sent to the lab, again, Noguchi Memorial Institute of Medical Research, and the report came back as positive COVID-2019. Both cases had no symptoms on arrival, presented with symptoms of fever and acute respiratory illnesses, and they were not having signs and symptoms time they were crossing our borders. Both are currently under treatment in stable conditions. Contact tracing has started. This brings to a total of 6 confirmed COVID-19 cases in Ghana, with no death. And this is the situation as at close of 14th March 2019. That was yesterday. All the cases are small. All the 6 cases were imported into the country. Distinguished ladies and gentlemen, permit me to use this opportunity to remind all Ghanaians and people living in Ghana to adhere to the preventive and precautionary measures. Key among those are as follows. Wash your hands regularly and thoroughly with soap and under running water, and use alcohol rubs, sanitizers frequently. Avoid shaking hands. Cover mouth and nose with tissue when coughing or sneezing. Dispose of the tissue immediately into trash bin. Keep a distance of at least 2 meters away from a person with fever, cough, sneezing, and difficulty in breathing. It is advisable to be physically active. Everybody is advised to drink plenty of water. You have to eat healthy food, avoid stress, have enough rest, have enough sleep. Restrict travels to essential travels only, as directed by the Excellency the President. Stay home if you feel unwell and symptoms of fever, and having symptoms of fever, cough, and difficulty in breathing, and call the following number immediately for help: 0509 497 700, 558 439 868. Before I
for Ministry of Health and Ministry of Information, and I would say only a short press brief not quite long ago concerning the current situation now. Say Ghana a coronavirus no e dia pakuduna quickly. Yeah, be kwa humano so na ye a professional doctor, Dr. Afiah Acheampong, the United States of America, or one of the centers, and onimiare and we sit here, anyone should so as a Ghana for crying, you say really bad. We are going to speak and throw more light on this particular sickness here. Spread here, says the Acheampong, and I answered them, just why here house arrest. It's quickly, young Mansonia document. Doc. Yamuajoba on Neba Media swearing.
Yes, Mamajo.
Esa Okasano, Emma, feedback at our way. So, for the speaker, I'll be here to my mother.
Yes, Mamajo.
Doc, yeah, also. First of all, Dr. Afiah Acheampong, yeah, share the atmosphere of America to say. Concerning the area day.
So the America, most places no, yeah, close to your schools, be synagogues, be so churches, baby, oko shopping na say, baby, oha nipa ne doswa, omo ma nipa kakra ni remo, na omo makano, ya mo biya jina. 6 feet apart at the line.
Okay.
Sebeya, omon ben ni pakra, udi line mo, mom kamu.
All right.
And the situation no or ground no, and your hospitals no so no. In most of the places where virus will be break to say New York, New York, you were New Rochelle, and Long Island, and Seattle, which is Seattle, Washington, and California. These 3 places are really affected.
Okay.
The measures near a little bit harsh these 3 places right now.
Okay. Now, Dr. Acheampong, Yamra form, because we are going to speak to our local people, which is the Ghanaian communities here. Omo Abruchehane Ghana. Omo na 8 years. As I it's true like as a Ghana for most of us now am finding serious because the rate here spread no a free say blood cry your blood need to me resist diseases na area no, but we are going to talk about it. But first of all, educate us. Coronavirus no area
Anti-coronavirus no among us a family of viruses be sometimes be a be kum nipa bebre near friend is SARS and we know wafa a different form antino semi city no near friend corona because that's a wash a crown anti a bar nature or particular symptoms be a beba mo who say yare no acho. Number 1, a go through a befa when Ohinimo and also Num and your friend mucous membranes. Into either say will be a bewo or no when ya really be no sar transmission no intimate castle or go so but even if you have been ni pakrono vicinit ubenwa who say be antini who so be anya be ani ekohwehwe o ma wo ben no if say wo ben ni pakrona possible say me hu bibi aka ho a enti we very about we no nti say abrochihakra flu virus na say anything or when you're 10 times infectious than that.
Okay.
And you know, it's me manipanyan in 10 temper. A call Uhimuni weni and Wanuma. And yeah, what do you so sure? What did you be and who bit me? I'm like, and I just say, why infected?
Okay. Look, Metiasia here, say Obisha Atari, now also virus, maybe now also Kosa Atari Cronwa, a bit me and now be the let's say sponge graduate, no also virus, maybe now also the Adio Dian no can of one, a likely say bit me about Swana.
Because a year contact.
Okay.
Oh, contact means say a call onto entirely, a call onto metal spaces, onto paper, onto wood, any metal, any cloth.
Okay.
And a possible say obibi bi a unsabeka no send a bag no so mu na so mu bi ni nyina e bia no aboa ne tos otimi ewo mu e ma wo so do sakoka na also
okay.
Yo,
I was here for joining here. How you want media? Your name, Dr. Afiah Acheampong or United States of America in bon common or explaining your match because as a person amount for years, you know who you are on the way and near my ICT airport. Awful. Doc, what are some of the symptoms? I really can't be obey then because some of us know we are new and I say I hear news because you won't be sad. DNA will be one bit say we dear say I really be now obey one of the suspects.
And it's say a fever acquire one of the things yare no etimitre no you so say ye be share airport the thermal meters asisi ho a wo kwa etimitre se bia wo temperature ekosoro why she na eno no a cramp no obi ohono ma yare no e wo no ho fofra na onya ya obetumi so asafra nipa mu wonim se yare no no ho the other one so ye say obebowa but one ye ebi wo ha e dry che se unti ahoro na obi on so be start say oti ahoro what possible ya Enti eti said you be nya ye kana malaria na say fever also nya malaria fever or posio ya honam yo ya uti yo ya awode ni nyina ye symptoms but number 1 no e fever and some nearby cough nearby a breno na de ba ko ka ho em say enka malaria ho any say afi de you say won to me home eno na na e serious I do time yare pe say ejo either say eku na say e you bibi ntino omo entumi home nyina no edu sa time na ha say ne do omo to afidie so ma afidie no home ma wo mo ye krom ho de menim se sa de na ebe den enti sana etie
yo doc yemhwa de aboa yi yemfa ne se o benya ba bi tena ewo aida so atarim de ameti ase se de o kan kra na se telephone kra de kasa nyina no virus no betimi atna so
so phones no kasa no nanka me kan camera be check say you between avoid it
all right we will come to that level yeah there how long na boy will me survive war because if you say within 2 days be won't me survive be is it true
but I didn't say it's say gusu aye ho hwehwebun na omontimi hu say even cry ebinu say awiem ema all that and up to and Department of Health chair say yentumi hu aboan hu niema ntimi hu be obewo fi say no mo gidi say ebi cry ntimi ma Africa
okay
and so say aba ama share trend now from Algeria all the way down to Ghana, Cote d'Ivoire, baby abwan obi o ha wenye bia anaso de bae na you baby o hono ma omo no obi antu kwan e Africa kro no ma so a enso no aspread o hono ma ni pakro no wan ko baby a enti se wo watade mu a de na wo busa no ye se bia aka baby na wo don sa akoka aha enti se eka baby a na wo don sa akoka na ekọ wanu ana se ko ohwinimu ana se ko baby a wonya baby a wo honam ne baby a eye mucous membrane baby e ho no nsuo wo no ohwinimu ni wani ni wanum na enya ye no ano na de ne ho akoka ewura wo honam no omo wura enti e ho no nye se nsuo hie bi na ade koye
Okay. Doc, let me come to this particular issue because Ghanaian communities now, Europe, other across the country, no, across the world, no, if you know, make a lot of suggestions, this particular virus, why I can't answer me, your blood system, no, it may resist this virus. Younger dear. Ayampa, sorry, post yet because someone grano, or won't me and snabby a hit won't Africa grano, we have most cases I report to her. Ketua been a war Africa, most of them 1 hour, Europe, US near the norm, in the excessor indeed. If we are to go by figures, Yababon, Sanayam, Passe, and one or won't mean is that a case?
There can be just science about it. According to science, no, she just your immunity be just abone more. Abono intimate na
okay.
There's nothing that backs that. And I think so no. It comes to countries now. As a call round into China free, now starting, almost started dealing with it. No more the coffin, but by that time maybe Musa Abba Kofufu Bisunti. I say time Okona and Kofu to Quina or Mokono, no more than Tikwana Echo now. Yempa boni senke intimi nko etwe na enko kanipa fi se me hwe yekroma the way city na kanipa minim kwa be fa so a ye be dealing with it if you say you need capacity no ye de be tumi ahwe nipa no but enisi e fa no agro the World Health Organization aka say yenye Ghana Health organizations aka say yenye no eno na wo se obia ye no de bone ho bai if you said obi o ha ade no won ho say omutimi hu say obi o ho won ho na immune system ti ono no wa anyare o enso na wo so be no na wo wanya enti omutimi nche.
Okay, Doc, yemra some of the measures so banzane beba niema ye de besia no kwana betimi prevent say nya sayare yemhwa de there is also this issue circulate say yare no ontimi alcohol enti ene adonko ne obada na ne ade no unya bi twa na peteshekura no a ene ye woto mu anu awu afei yesi yare no so ensentimi enka enkura kese eka empanimfo eso mu anyi no mu ya bewu ya no so what's your reaction on that?
And enti de betumi aka fa ho ne se yare we nyame adom nkola for some reason omo no so sempenifo omo a omo nya no nkola nya omo mid 20s nya 40s nya na afa mpenifo nya o che nipa dodo a enya pa na ye nipa a omo di 60 and over ena nipa a omo yare dada obi o ha o akoma yare obi o ha diabetes obi o ha o respiratory and okay, can I say respiratory illness like obi ne home be asthma ne sani mani am COPD obi dada enti no ema omo eye open say yare no betumi achi omo mo entrese ntimi nchi obi a aye obi a ye kraman krabi but entrese you know anybody and when it comes to death now majority of the people who have died no esa empenifo no ene ba enso no nkola ni bi so awu eno so entimi nkyase say edi entina we yakola no nya bi no wuye enti ye wo sa kwashi mark ni nyina wo no ma omo ntimi hu yare no omo ku yare ni ntino wo jira nkra ni mo tete nkra ni wo ku yare no na wo sa hwehwe mo nti the air said a queer faso winyan near so be a mon hompai. Okay, now me patcho say alcohol no a ubodino and also near bibia a year adia yatro atubo konkani and kahana and alcohol hanka for benompa but entisa.
Okay. Now, Doc, answer your beba what can prevent no quick idea about what men for being answer. Ebinum say area no okore pork she said and some night say the bree why win Ghana for nsamba you want the means Ghana more grounds no area no e dia na de ba poti
enti say yes kan no baby e free no omo kire say wild animals na omo area no emo anete sa wild animals to say bia your friend up but alpine any other wild animals na yes Chinese fonton emo ani be ti umo obi antimi hu say eno sa story no e ho ne free buy na ana say e free hin eno de obi a won theory but you say a free baby a o say na ontimi hetin crofo no abda nipemu 96 say na abda nipemu no enye so kori bibi na yeti honum se Ghana da bia omo wi ade hwe nye omo enti say ni de free abeto nipemu na e ko round no eno ho ban ne ebo obi e ko wasase so ye immune say ade no oni ne ba into contact enya.
Okay, now Doc yenhwe some of the preventing measures ye bia tim de agu akwan so ma Ghana fo e wo afidie na etie no o ma hunu ekwan a o mbefa so a o mbe protect o mo against this particular disease kidnap ye nyina agu damu
entiane say no de akwa ni say yenim say wo nipa mu bebria esan sa mo bosu te se bia akukuma si dwoma na so akọ makola market na mo bosu na mo ko na mo kasabu nipa so enye wakra na nipa bo okro kasakra na sanke de yi hwa obehwe entesu efri mo ba etimi ko way now ohia bibiki to be just a droplet like little very little say obi baby now if you want multiply enti eno ye number 1 number 2 it was besides all the ben will be no we will take care say the ansaka no yentimi kranchire we so we mu no ni cross akwakosom na we so akwakosom yet na trotom ye fa hanom wa wo kra wo niema odo nsaka bibi na ade akokan phone na ade akokan bag na ade akokan wani na enti won sano ma dia metre e wo ha ne se obi a nhwe se bia ne nsa ba ko wode beye the dirty hand now so me nsabenkum na me de tachi ade na bia we se no na ade tachi ye emfasa ansa no anko show bag mu na emfasa ansa no anko show bottom na emfasa ansa na anko fa keys enti so won sa we na ade keka ne ma na afi wa hwe se won sa ne clean no wode be kwa kofa seminar na wa mo bi afayi e di nsu egu nsa so wo de wo nsa fi na akoso ade ma wa sa ade na koye bibi foforo ho even crowd of your hands
practically this is very dangerous ade power to I mean to control it and mechano
just say me parking my car parking lot na New York City. Na me parking wo honoma. Yo parking car no minim na so obo wa so onye den say wo horo ne nsa so ahoro ne nsa. Enti say me see ya pe no me pepa me nsa ansa na mako. Na me ba na say me pepa me car na me bie car no abonten a e wo say me fa hand sanitizer me dey sanitize me ona me fa na me pepa ba bi ono de ne nsa so ye nyina ansa na me matenem. If you say me name, and they said, "Essence say your what said my munti was say, yeah, to me level by example." Chenko said, "This is what you need to do,
all right,
to protect yourself."
I was here for Yane Dr. Afiah Acheampong man kasa every United States of America na or educate kakra on sai area koso coronavirus so aka nyina ya gudem. Doc, enchakra ye beja wa moako. Yanjadio, as we speak, mona more grounds, more doctors now more adwuma hospitals na various hospitals no musra na e hu bia bono.
E hu die. Ye wo emu ahodo. Ye wo omo wo nyame nti. Omo gidi se onyankopon tumi no akata omo so. Na sa yare wo nso de eno kwa ni ade a chese wonim se ebetumi agyo.
Okay.
Number 2, ebi no suro because suro se obewu eja nkofo anase bibi be no. Ebi so suro efi se wo eyade a wontimi fa wani hu na wo se even kra ade bi wo ho na ade na mo anase wo fa bi baby na ade na mo.
Okay.
Wani hu enti being on the ground no you have nkofo a more genuine fear say ebi be omo na ebi no so nim say okay ya de ho abafore nti say bi ye won so a enu ni na wo omo so a omo nim say o mefe mo menamu onyame emoja na ekata me so enu nti na me nam. But there's a genuine fear who say there's almost try some back come on crowd down said they are panic and man now be a move so.
That reminds me yeah information Mr. President Trump yeah American president ya wo ono so kura ko siki advice and I say wakosiki advice from Jewish I don't know, minister Jewish priest be okra say amen declare America say monye the state of their fasting and prayers now. Meaning how true is that?
And there was a National Day of Prayer for America still going on until 24 hours, you know, different churches, different times, different prayer groups. It was announced until everybody's praying is on different news until we spread it out to our friends and family outside because ye gidi say ade bia ye plague ultimi hu anodro hu ade no na na ko. It's a war waged against you but na na ko enti de obetumi ayes ade we nyame enti say ye politics o say ye medicine o say ye layman o say ye fearful ye na bomo my neso say onyankopon NGN free sade we mu. If you say you see percentage nipa be wo no eye nipa kakra bi krampo na why no pesa ye nipa 100 ne ka say okay mumu 20 be wo and then it na ya why no pesa de no ho ba for ye why no pesa ye de maami ana ni nua ba for ye enti even though mo kasa no eye microphone starting so ya say within a short while no it's wiping away a lot of things and people who with other diseases yes but this is very short and quick.
Okay. Doc, wait quickly maybe our final question before we go. Maminchia me anka se me nua baako Linda Acheampong doc also America we name yene Dr. Afiah Acheampong so na ebo come sister Linda me chio me fro yo yensha the doc there is this message I may receive ni kesesi from Okatachie George ni okaite yi ho wo se se wonnom alcohol a entimi emwa yade no nemom you can wipe and clean your surface with alcohol you know de ebetimi aboa ana afei wo se wonnom alcohol so a or see a destroy or system no ma aboa no correct me etna wo ye no ko etimi ma saa unya infection ana infect you know virus ne ba mo we dey mo ekunta dog ebi se me hu video obi akoto adonko a ode wohoro ne nsa wohoro nanim because we say yes we the alcohol ka on san wanim a etimi by dog gina so ansa na be isa asem na minyi video ne nsa man for just a minute na yet to ankomo so na etie for hwan senti wait 1 minute pe
and then yes corona ya bo na me de metie yes emfa alcohol sanitizer alcohol ewo mu emfa hwan sa na Ghana de ankwase asem Acheampong ya 3 cedis sanitizer and na mekoya yesi 280 Dr. Waguti adonko is 8 cedis alcohol ewom adeyamma no branso wom nti we corona kra e kan wa obewu timi do any twaminsa don go to test fa kire wo mo Ghana fo nkwase asem nko a ese ma fa corona hu ye sanitizer 2 cedi 3 cedi no mo de 20 cedi timi nia ebi kwa 30 Tuni wadonko bitesa ako wanapomma Yede pamkolona tu yana di jua faso ka krebe no ano no awie da atamadi asumame akoto sanitizer
for this is the video a trend or Ghana enti na obi kura frame sa oheba yesi unya peteshna o de bo o de cotton ana asawa bomu a ubetime de afrafra won sa na de bi afra wanim na ti say o sister no so hit the kakra and ayana so funny say ese Ghana ye de niam bi say edi agrobinim how true say bibi set doc advisable so beto apeteshe ana say adonko bi na o de asrasra won sem
said the baby and Crofonia said in a free alcohol hand sanitizer no na a choir first year alcohol hand sanitizer and was say alcohol a woman now isopropyl alcohol na yedi no was 70 to 90% of alcohol and yedi ya de no yedi awuyensa na say yedi wipes won yedi afipayensa those formulas no ye bibia e kire no say yebetua baso a metua kire ma no say omo alcohol o metua ye bi now as far as drinking it no there is nothing right now that would protect you from the virus but immune system here alcohol now smoke you have a decreased immune system and actually drinking alcohol is not helping you. Immune system kostra. Green vegetables and fruits. Fruits are Ghana to say citrus, lime, orange. Then it contains high level of antioxidants that can help boost your immune system. Enough sleep and exercise, breathing in exercise to make sure so lungs are good and I say your lungs are healthy. These are things that we should have before we have the adenobeba. And it's all because alcohol and also condom bibi nema ye did too even cold as no. And ye bibia ubetumi because adenonya ko hnimu ya. Eko ya na ewra wo yibu. Ewra wo honam because oni and those things now and go round for us to make sure say we can break down those information and no crab and also me pacho minimum appetite and say stay alcohol and say I have no idea but the minimum say you have 70 to 90% alcohol no and only hand sanitizer na ye de hohoyensa but how you're touching your face, watching how you're doing it throughout the whole day. If you say yensa can be all the time Nti sadi wo ya ye no onsa ka bibia no wapepa onsa ka bibia no wapepa that's why ukra alcohol no.
Okay doc, finally before you go, I am say amount for be break 8 year o share most of the shops here e wo Europe wa o matutum Ghana so matutum obi okra nso a na o fie nam situation here community yen hwa de o apart from say o call various shops akoto bibi protect ho no can you educate us bibi kakra bi wo fie na ubetimi akere bibi a individually ebetimi aye for wow apart from preventing measures here odi kadi to dwa no how I beti aye bibi a yepetimi dia clean your hand nails nyama na medicine bi nim se bibi sa wo abetimi educate you on that here.
No na me nimpo sebia ingredients a woman no samo ni nyina e wo Ghana but so unya bibi to say alcohol ya making na unya
no sorry alcohol talking about appetition na say e dey alomo ana donku bi no okay ba ka ta alcohol bi akoto
me enya no na make ya wo isopropyl.
All right.
Alcohol antiseptic ye tono to say also hospital na nka ye be wo pani a ye de asawa ne bo alcohol mu na ye de
body dance and yeah
sa alcohol no ofa enubi any hydrogen peroxide at first na kro ye di me kri
okay
anti-alcohol, hydrogen peroxide, and regular ensure kakra, but ensure was so noa. Also no ensure answer. That would the alcohol no ebia so the 1 cup. It's me the gum minim segana aloe vera minim ni din anase bibi to say enkola baby lotion.
Okay.
Kakra bi o de stomti alcohol no fa be say 1 cup o be fa ebia your friend say lotion no bia 2 ounces cry say 2 teaspoons 2 tablespoonfuls now say wo the we no hydrogen peroxide no enso kakra egum no mixing nyina fra saa no wutumi di gu bottle mu kra so wo do saka bibia no hwe kakra na odi apepa onsa because alcohol is very dry and the lotion is what is eno na be ma onsa ho nye so dry na alcohol no between atena onsa ko na etimi ekuma aboa no ka aboa na what it does is that
okay
ekum no free onsa ho but bibia obe touch bia no eno ane say obe ye sure say wani wanim umansanko because ekoka bia wafna obe hwa ne say increase na sometime akoka wo hwene mu ana say bibi nti you try say wanim and a phone to cry me advice ne say phone so wo headset you so no chance or the phone better was so the better was so fi so the one saka na so the akoka
me say me super and me dey be ebi nya me nya sure
okay, those things no it is a base ofia enema no no be na obetun aye ofia obetun alcohol is one thing that's effective over virus no bleach is good for antibacterial but alcohol we need a good on the virus and no mintimi ho appetitia na say enema no alcohol dudu but ebi a metwi no akasa wo echi na mahwese bia appetition wo equal sa alcohol ibi dia I have no idea
appetition wo dia any aka Ghana for
baby enye se wo no enye appetition wo no makom
say do what the kakra efra inside dia be kanaja wo twa dia didi
na we person protect your immune system so at this time we chance na ensana emwa because anything either your esophagus or something that a back can baby a wo my fan and so no emwa smoking any drinking at this time no is not good for your immune system. As a matter of fact, you should stop and begin to build your immune system.
Okay
say wo shakrampo na wo yes ani mana you will be in the group of people who are susceptible. Just a bit me
okay. One important text message be about Obia can be more health sector here. You can able to also add your voice to that. Okatechie George the Biaba said, or see ubetini use vinegar. So I don't know how true is that one also, Doc.
There is vinegar wipes. It is there are so many different wipes. Right now, the only idea who say very effective on this virus. And like I said, I can show you so many different mixtures. Are good for house cleaning any niyama, but for this particular virus, you even need to make sure say 70% of it is alcohol. That's 70%, and also the proportion is right. And yes, until right now, I will not advise on vinegar or anything else except for the alcohol. You use Lysol and you use hand sanitizer. All of them have alcohol. It's alcohol in the woman chain BBR. And your vinegar there or other things, but this particular virus, what is effective on it, what WHO is saying, what the CDC is saying, what DOH, which is Department of Health, Centers for Disease Control, World Health Organization, almost alcohol has to be 70 and above in what you're using.
All right.
To clean, not to drink.
Okay, all right. Abusia for yene Dr. Acheampong, 101, or a medical doctor in the United States of America. Doc, ye jawo kra mo akọ ye bedo asese unya bre na wo educating ye na ye bon komo bebre. Say mama tete say doctors ni bebre kra wa enam sickness in the way see spreading amanfo ba ho you cannot able to determine instantly say nipa no wanya bia na wanya bi nti say bebre mo gigi leave say mo bre mo home.
Na me can say near esro no ho ebi no ho asana omuka na afi obi ho so a na yehu obi a wanya bia you happen to fall in the group. As soon as you fall into a group of obia onya bi na bia wo dem ho no ba ho no ye ma won kwa adwuma ene ye ma won pi enti no ye be ka wa hwefie na afi ya hwekwan be fa so a ye ba be test na chese won timi nkwa abonti no asa de akosan obi fofo enti ade na akoye bebre obi anim da ye be ka so no obi ntena fie enti sana ade na akoye na me wa ha ya nkofo bebre afrefra omo chese edru juada omo adwuma mo omo ma because also omo quarantine. They have to self quarantine means that bia you falling into a category bia nipa bia so bia wadamfo enya bi na o party na se na so obi enti e dem mo amko party ni na obi antena fie aha no Ghana de minim se na ibesi amani pa na antena fie ba ha de o ye kan ya na nkofo ye enti bo ho na watena fie enti wo no fie fo na afi wo de besa ho mo ba wo muntimi fa nkwa abontin.
Okay. Dr. Acheampong, doc, as I your dear numeri.
Yo, metamase.
I was here for a medical doctor and any bon common na or educated people. And you may attend some or media so. Ubet me and subscribe to your YouTube channel no or Hineba Media or Hineba na obo or Hineba Media. Na was subscribe to your channel na my Okatechie George ni or show a lot of text message but was say Chinese for no and manufacture this virus and afi omudi infected African countries no said the omuye Ebola no I don't get it. I don't think they are going to do that. I don't have any concrete evidence here. So because this platform is a big platform and we have to say it with facts and figures and proof. Yetmin ka asibia. Enti doc waka se mo a modi adonko horo mo anim ne monsa no entimi emboa mo.
And then there's a corona yabo na me de mete yes alcohol sanitizer alcohol the woman fan friends and na Ghana de ankwase asem ade ya 3 cedis sanitizer and na me koya yes 280 Dr. Wakuti adonko is 8 cedis alcohol wom adema no branso wom nti we corona cry kan wa obewu ti mi do any twaminsa don go to test fa kire wo Ghana for nkwasi asem nko a they say ma for corona hu ye sanitizer 2 cd 3 cd no dey 20 cd ti mi a ebi kwa 30 ti we no wa don go be test alcohol na komma the pam corona we are not usual faso ka kire no anu no awie da atama dia so ma me akoto sanitizer.
On the more serious note, yeah, grow as a nation. Yeah, we are bumping say you beat me a quit here. But there is another video so I circulating from a certain guy. Per information I gather and say on also or yeah, a medical student or China. On also at the video we about Bonti. I think it will also help my audience. Now almost wait see the video. No, we are now fee the comedian na ABC answer.
Good afternoon. I had here about no etwem apahon nti I had here ade besan no nti mechi am good afternoon. And anopa ye sorry enche kra be wie ya na me de me nyam shift nti me free hospital inside a befi. Na kakra wo ne say Ghana I recorded 2 cases of coronavirus. Na Ghana minim said yesi hu yare no said yesi tie na ebia ye doctors e wo no e powerful ampa ye de obi ado ye bom pa ne say ye doctors e wo no very powerful me kan ye Ghana kasam twi mu nti na afamosom na mo ate ase achepa na be bosome miensa ni na sa yare we epiem wo ha ye hu say na your coronavirus wa ha enko for the whistleblower no de who say yare ne wo ho no wono yare ne kuno de who say yare ne si yare ne kuno enkunye kura ku more than 20 something doctors e wo China ha enye yare a wasam didi agro say ayi ena yare bia ni ho ena de yare bia ni ho wasam take care ye ma me mo wo fie no mo yinyini omunye nkura biem omunyinyini e na yare na attack the immune system respiratory system no wahu hwe imagine SARS severe acute respiratory system syndrome imagine that but this is a part of family of SARS but we're a higher part of virus we're one of the biggest virus one of the most craziest virus a chew na immune system nye higher kum mostly no in a form of edujo ema lose breath it is a pneumonia anyhow but where high pneumonia level say ya nhwe ye na ye de yare we di agro ye maame mo ye fiefo nyina se behye hwe China ha na ye te no e ba bia wote bia no ye wa address system ye wo gate da shall to be like bebia wo bia gate kese wo ho a ye quarantine na ofamu a like the everyday ye use mask o hwe krom a obia hye mask na so ena bebrebe na nkwa adwuma na ye maame mo wo fie no obetima aka che wo maame se hwe no wankodwom na de na ebedi maame mu akwaje bosia o bank tisi wango juma ngo ye juma de na ono no bedi ana obedi odi betua bank foka ya nhwe ye ni ankloso ye borders na because oman bi e wo Ghana oman bi e wo wiase omo ye strong bia omo nim so muntimi nkosa yare no omo close border me he Ghana se nso to ne nso no tokese pa ye de hye aban de besi bia ye de hye aban e masa ade we me hye aban because we yare a eni say ye politics yare and is a fin NDC ni MPP. Sa NDC ni MPP to me in crass sem. Se yes, mumbi enyi sa politics asem ni mfrim. Ni enhwe enipa yare wo ho. Enipa yare. Ya anya sa ni anhwe yare na ekoso wo yenyenye yase nyina abehye. Ye nyina yase behye. Ebitimi frɛ wo sɛ ai yes say ori garlic It's me kum. How? Sena was it? I didn't a virus or some regalica. It's me kum moano. One of the strongest virus to ever happen. Me pamocho. Say Ghana mean for ehunu ya me pamocho. Sa time way a best time to understand what is going on. This is the best time to understand that. What China? Also, China is recording low cases now, but still now almost through. And yet, yare ketwani ye kana asem no. Yare I know the papa. Hey, say, we are more than 60 years, you know. You can understand so our immune system, no, not much, so strong. So what you say? Into your mono say, so yes, our virus nibia, nana a broma symptom. So what you say? And go for be why we are more ye. Oh. Nana, I dear way I can me pamocho. Say, Obia will busuya, one can't a busuya say, a petition, or no petition, intimate cum one. The fact is, I'm wanting to mean stay outside, no. It doesn't mean so must stay inside or more how. Mommy and yai, the adrenaline for frona ye nyano, ni yai say, because I, Yariano, in yatisi kruma. A beshi in Yase. Cause Ghana non to say China, a busuya, mammy papa, and then a banner. Ghana no, yen a busuya. Me wo from by me busuya, men a number, me obia busuyanti, me koha, yen as a beshi. China is spending over $60 billion. I was hard year way home. Na Ghana is spending $100 million. And no more as a Ghana the to me, a bit me I survive Yarena Yakano. Mummy Sardian and Mummy Grody. Mummy and Fian into form. Nasa, I was all row every 20 minutes. I was all row any more times. I was all share mask. To see Adiano, and Yabas area, no. Nyafin Abajana who say, a be bad, maybe ma, a be any cigar and on quadia, Mummy and Moya Hobine. Mummy and Moya Hobine. Near close your border, no. Yen close border to every country until say Adiana Sebeshi. Because here, Europe, almost capao. China, almost capa. BBS, the ombudsman try to, but Ghana $100 million and I know a ding. Yen close border to every. We are also receiving a lot of reports from different angles. Ohineba Media. If you want to join here, you subscribe to your YouTube channel. Ohineba Media. No subscribe. No me abdomano so my. Brave baby no when live. Facebook so ye Ohineba Media. Ana Ohineba 1 TV ana Ohineba Media bia oba on sabe kan website www.ohinibamedia.com. Let me read a text message from a man of God, Prophet Onyameba. Was say Ohineba say a man-made scam. Yeah, omwaye intentionally say omwe be create yarea bana x-ray no omwaye vaccination na omwa tona people arane anani pa aduane akope biato enti we enkrofo bi na create ade ne di pesca. But there is also a gentleman our calling is here said he want to share some information with us concerning this particular sickness here trending. Was he a friend or Ni Okante, all right. Also free America. Okante, meaning so Dino Maboni, yeah.
Hello.
All right. Okay. What kind of information also on here can enumerate? Now, let's hear from you.
Yo, Mamentia will be here or here on a Jumedi will be here. OT Jumedi. Or by any say, sir, virus, sir. It will be a thing now. Being a manufacturer. Now, your countries are noted for Tanyamano. My main franchise here free Ghana, Gine a Halabu. Oh, you will laugh culture, like incubators, grow culture of virus like bacteria. As obi research na onye adro bi say adro we ebetimi ekun ya. Ehona abane de ko. Emo mo test on those virus na omaguru no. Se na be ya omo betimi approve say okay adiwe etimi ekun no. Now China me say ko mo ye ne say say we are seeing now akwese abeye like syndicate be in Kunkuru no you know omutimi develop like virus in say in case be and to be fear omutimi be infected and kufu already infected like well and kufu but in the case of China no omu develop virus we no obia emide ne ho say COVID like 19 also no so like COVID-19 ni fi fa omu manufacture adewe a year ago but unfortunately no omu lab na omu no manufacture and conform ye no omu ye mistake o man take like precautionary like measures well and omanga sa ebi ekeka omo ho a omo di pia bonten a omanga sa kuo no abe infect o mata mambe for it like Ebola so why Ebola na so what's the trend na Ebola ba no Africa na ebe sati free you na Africa ono so no enkura ebe sha se free so no enkura omo diamond kwa Swara.
I am yet to find out.
In the case of Congo, Belgium, developing live virus lab.
Belgium, fine because we can able to trace and find out because Belgium there.
Let me find exact when I catch you.
You'll be happy.
And only call Chronoso. If you only buy Chronoso, I didn't say to as a Kunkrofono. I do on Bayane say, Ubia Shefima, Ubia MP, Ubia la avoid a contact. It must you know. No musu or mutu like a diamond no. Edeko. If you say, oh, almost on my colleague like mass grave. Like I'm out for
now let's come to let us not shift attention because you call me back say what important message to share with us. Yeah. Let's concentrate on this coronavirus here, baby. Because the whole Kenya, I don't know, is there any backing? Because information I share the issue and the amount for some penny for so because
the backing no. The backing let's say what you say a better buffet woman or develop a solution to a virus we know will be like Chinese one another.
Okay, for instance, you have to say cough from omo etimi control virus no onya sure say omo you can say health omo scientist ne omo health system no na omo well equipped into omo bu omo ho akoatia because they all kind there you nyina you need proof bia o
oyeba baby where omo di making money because we see no ekobale sana a World Health Organization, solicit funds from donor nations. No, in order to say, the labs now, Ombi so omo betimi aye saa adwuma no etimi develop vaccines ne ye ebetimi bring saa enema way down. It is here no physical Chinese for now lebeko.
It's only officer a scam.
Solution uti we are a big scam.
But the problem is that you really it is rare.
Yeah, it is there.
Okay.
It's there. It is there because you manufacture virus no. All the nako omunitadi is nako ombene say. Omu manufacture the no lab we no. Nanka omo become the aba enkro bi so Africa enkro mo fi say omo no where me now work e was no.
Okay.
Na komo de be infect omo. Kanka waasa quarantine emuni pan say ahanu mo serious say no omo nya wo di tu omo ne ma.
All right. Now.
Who tell me?
Okay.
Who tell me?
Me too.
I'm so tell me. Like Ebola ba no. Who say Ediba like Ghana. The BS wo. As me wa no enkrofo World Health like organization everyone move Africa so one more treating Crawford they were saying in Accra and upon no ombasa play the call
Okay, right.
Back into Accra.
All right. For then somehow or Hinebe Media. In fact, I haven't done any check on as to also Mr. because we are all learning Nayesha there. But our friend, now say, a certain information our person on here. First of all, Meadow was so sorry nowadays, but I don't want. Remember, some I can't say because I'm on for suit you, and people are breaking their mind. Let's say a manufacturer, say a manufacturer you. Official, you said then you approve the answer. My dear, can you now? Me say yatete, yadre say because the old Kenyan and there is no any proof backing unless even if information and I know a draw from China, it doesn't mean that they're okay. You can able to substantiate it because the old Kenyan no evidence be our tender before. Never maybe a bit because they okay. I am no correct. Be what did you come over because I sense your say the echo so the imagine says say obi kura so betima as say I am who yare na a punishment and Yankopon di tia China for kentin e go free. It doesn't mean say I am pa. I think what's the word there but I am fancy here na etiefo no will be the best
to ABC like ABC News like America President Trump and then the health like secretary CDC you know omo like press conference na o de kone koti omo say omo ka say omo sha say edi wunjuma but a bit cure anywhere from a month to abosome like me was no China for etimia year omo continue omo bring enema no like down eti eye omo no manufacture no omo no munim kwa omo befa so a omo ba mistake omo ye ne say lab na omo grow ye no enkrofo na no mo di Trajumano. Mistake no mo ye na ebimo
Abiria okay say enkrofo no this adwuma a who are those people? Do you know them or obi na control? That is my point.
The scientists.
Do you know them?
Me one now for 4. I don't know them, but me one now for 4.
Okay.
We are for top scientists.
Okay, all right.
Well, like
okay. William said on common besides what me cool point. Thank you very much for joining us. Abusia for Hinebe Media, I am say of friend more say or person share very important information. But me tie no na say en common na work and who be here say tie bi. But I think more tie bi tie for be the people am be jeje asem na me. Abusia for na no usu adjuma ye asantfo hin na Berlin. Na ko si adjuma banana baby obi am chi ona sen na oba pe free mu nyame enhye oni afi na magema na nanso baby a obi a mechia obusuafo am wo so nyina prophet onyameba ekire wo so mefro onyame enhira mo ne metiefo nyina media ne ohene ba je ni ma ko betimi akọ YouTube no subscribe account na mai mo amoba so nyina no medam nyina mo ase mentimi mo nyina mu din media ne ohene ba je ni ma ko ha ye ohene ba media makramo